Hi, my name is Amanda Mixon. I'm a physician assistant. I practice in rheumatology. I've been in rheum for 18 years now, and I practice in Northern Colorado for a large healthcare system. I'm going to be talking today about the utilization of MRI for the axial involvement of psoriatic arthritis. And, when we think about psoriatic arthritis, we kind of put it in this more broad category of the underlying spondyloarthropathies. But I think oftentimes we focus more on those peripheral joints that are involved or the skin that's involved. But we really need to remember that 20 to 40% of patients with psoriatic arthritis will have axial involvement. And sometimes that's the presenting symptom. So you certainly don't want to miss it if you're only focusing on the more peripheral joints or, looking at the enthesitis or dactylitis, etc. And what I would start by saying is it's important that we talk to patients about those inflammatory back symptoms. So pain that's waking them up in the middle of the night in their back, as well as kind of that early morning stiffness in their back that will get better the more that they do. MRI really does play a critical role because it can pick up those early inflammatory changes of sacroiliitis that you often won't see on a plain film. And I think it's important to remember too that some patients, you may never see sacroiliitis on the x-ray and you can only really see it on an MRI. And so really this has taken, such a critical role for us because we're able to detect it early. And therefore that can help shape what our treatment plan is for the patient. Because in psoriatic arthritis, we really try to focus on this domain-based approach. And certainly if you have a patient with axial symptoms, that's going to help determine which therapy might work best for them. An MRI can be a really great tool for you, again, to pick up those early changes, whereas an x-ray, you may never see it. Thank you for listening. For more information, please go to the WRAP website or go to the WRAP ACE app.